Can a consultation with a telemedicine doctor actually cause diarrhea?
Hit the subscribe button and the bell notification to become part of the Transplant Helper community.
Just in case you were wondering what telemedicine is, it's actually when you sit down with a medical doctor remotely via some sort of an app, whether it be on a tablet, a phone, whatever, and you actually try to complete that visit via that app. That is, you don't go in person, you just simply kind of have a phone conversation. Now, I know this is rising in popularity for various reasons, mainly convenience, but I did want to talk to you a little bit about a study I read just recently that really shows it may not be the best option. To summarize a study published by the Journal of Pediatric Medicine, the study actually showed that children who were seen via telehealth were actually given a much higher rate of antibiotics than their counterparts who were actually seen in clinic and got a full exam. Now, you may ask yourself, why is that problematic? Isn't it the case that a child who receives antibiotics is actually receiving better treatment than the one who did not? And to answer that question simply, the answer is no. Actually, most upper respiratory infections do not require antibiotics, and in reality do not even respond because they're typically viral based, and antibiotics seemingly only work on bacterial type infections. And again, someone may say, well, what's the big deal? Again, aren't they receiving better care by getting antibiotics, even if they don't actually need them? No, not necessarily. In fact, receiving antibiotics when they're not needed can actually be detrimental to that child's health or our health for that matter. Now, let me briefly run down a list of why overprescribing antibiotics can actually be dangerous, if not just wrong. Number one is the obvious one, cost. You don't need to be paying for medication that you simply do not need. And too many times, I feel like that is the case. You go to the doctor, they feel as if they have to give you something, or at least that's what you expect. So they write that prescription, send you out the door on your happy, merry way, when in reality, both you and or your insurance company are simply being overcharged for something you didn't need to begin with. Number two, antibiotics are not benign medications. They do come with side effects. For example, like mentioned in the beginning, diarrhea is a huge side effect oftentimes of being on high dose or longer term antibiotics. And I know I've never had a day where I woke up and volunteered to have diarrhea, even if I thought it might be giving a little bit of benefit. But in this case, if you're suffering with a viral type infection, you're receiving no benefit but all the bad. And finally, I'm talking about resistance. That superbug we oftentimes talk about, that overuse, the overprescribing of antibiotics can actually lead to your body becoming immune to the use of those antibiotics, therefore allowing some type of infection to get in your body that simply cannot be treated. Now, I understand why telemedicine is so popular. Obviously, the convenience of it, the time saving, being able to see a doctor maybe that's outside of your town that you wouldn't typically have access to, that's a great benefit. Being able to see a doctor when you are out of town, maybe back in your hometown, see your regular doctor via telemedicine, that can be a benefit. There's cost savings involved, obviously. Typically, televisits are priced out about 50% less than an inpatient visit, but is it really worth that? Are you really getting the same quality care? But to me, what is truly alarming to hear is that doctors may be leaning toward telemedicine visits simply to bring down their own costs and to make their own lives more convenient. But someone may say, well, Jim, especially during times of COVID like we've experienced the last few years, in this case, isn't it good to make your life better as well as the doctor's? Well, yes, to some extent. However, the overprescribing again of antibiotics can be a dangerous thing both for you yourself as well as society. And there are a few reasons why often telehealth professionals may overprescribe antibiotics. First and foremost, number one, they don't know your case. They've not sat down with you personally. They most likely have never done a real exam with you. You may be meeting with someone halfway across the country that's associated with some type of association of doctors or something. They just may not have that face-to-face interaction and experience with you. And that's not always a good thing, because when you build a relationship with a doctor, they kind of tend to know your foibles. They tend to know the things that you are oftentimes complaining about. For example, if you've got someone that comes in on a weekly or a monthly basis complaining of back pain, a doctor's done an exam several times, they simply don't find that pain or don't find evidence of that pain, that may be for some good reason. On the opposite end of that, you may have someone someone who never complains whatsoever, never experiences any pain, never complains of being sick. But yet, if they come in face to face to a doctor to which they are familiar and they complain of pain or some type of aches or some type of symptoms, that may be taken much more seriously than it would be by a telehealth provider who does not know their situation and is not familiar with them on a personal one-on-one basis. Second, if you're doing a telehealth visit, there will be no physical exam. I know I can speak for myself. Anytime I'm offered a telehealth visit versus an inpatient visit, I always refuse the telehealth. I would rather be seen in clinic myself. I need things like x-rays, EKGs, echocardiograms, other tests that may be done in person, blood work. I need that to be done so I can be sure that I'm giving the correct diagnoses and / evaluation by my doctor, and you simply cannot do that without an exam. You take, for example, a young child. This is a pediatric study I was reading. You take an infant who cannot really communicate. That doctor absolutely has to get in and see that baby in order to determine, for example, if it has an ear infection or some type of an eye infection or something of their throat. They need to get in and do a physical exam, and doing visits via telehealth simply do not allow for that. And oftentimes doctors that are meeting the majority of their patients via telehealth, they may be practicing what I would call CYB, that is cover your butt medicine, as opposed to anything else. Oftentimes they will prescribe antibiotics or other medications without that exam, simply for the fact that they want to make sure that they are covered in the event that something goes bad, or maybe they're covered in the event that the patient themselves are dissatisfied by the actual visit. I can't tell you the number of times I've heard somebody say, well, I called into my doctor via telehealth, or even sometimes went into person and I showed him my symptoms. He did an examination. He didn't give me any medication, so I'm not happy with that doctor. Actually, what we fail to realize is oftentimes medical personnel are actually graded based upon two things. Number one, the time they spend with a patient, and number two, the medications they prescribe. And that's simply sad that patient ratings are based on that. Just read the reviews, go online, check out some of these review pages for doctors, and most time the complaints is that they went in and the doctor did nothing. When in many cases, the doctor should have done nothing because there was nothing deemed worthy of needing to be done. That's a lot of done's, right? But anyway, doctors do practice that way, sometimes cover your butt medicine, and they really shouldn't feel pressured to do that, but that's actually the case. Now, to kind of restate that and prove it, this was actually shown to be the case in a study done back in 2018 prior to COVID, where telemedicine doctors actually see much higher patient satisfaction records because those doctors gave them the medications they were looking for. They basically gave them, in some cases, the diagnoses they were looking for, and people were happy just to move on with whatever the care they received. That's just sad. It, again, is just sad that a doctor could feel that way, and it's certainly sad that that's what we oftentimes do expect, honestly, from our healthcare providers. So unfortunately, in too many cases today, the doctor's number one priority is to get you out that door and to make sure you're satisfied with the care that you received. And sometimes handing that prescription is exactly what accomplishes that, when in reality, what they need to be doing is doing a thorough face-to-face exam, spending time with you, explaining to you what lifestyle changes may be implemented either to prevent your situation and or to improve or even cure what you're dealing with at the time, when in reality, that's just not being done via telehealth very often at all. Now, to the defense of all who do often work via telehealth, these medical providers, let me say up front, it's not always their fault. Sometimes, particularly during the COVID being at its worst, they were actually forced to do visits this way. That's all they could do, and that's just the way it had to be. That was very unfortunate. But now, since we've shifted out of that and it's gotten safer and safer to go back into clinic, I would typically suggest that if you have access to an inpatient visit, take advantage of that and feel lucky that you got that type of access. With that being said as well, I'm certainly a man of technology. I'm glad that technology has evolved the way that it has, but in this case, we just have to say it out loud. We get better quality care when we have an inpatient visit, and in some cases, you may even avoid the diarrhea. Stay stronger, friends.